Let me just start with some words of the historian Arnold Toynbee that I think is relevant to the focus that I'd like to see in the discussion. He said, "Our age is the first since the dawn of history in which mankind dared to believe that that it is practical to make the benefits of civilization available to the whole human race." And the name of the game of global health is how we, particularly those of us, the 1 billion people on the planet who live long and healthy lives, how we can make a difference in the 5.5 billion people who do not have that privilege. We've been asked at this session to deal with two general questions, and I would hope our speakers who have tremendous backgrounds and experience can do so, and perhaps at the end we could try to pull things together. And as a framework for at least one way of thinking about global health is to look at the burdens of disease that we know about. And here I would simply point out, back to the Toynbee, that the life expectancy in 1900 for the United States was 47 years, for the United Kingdom was 35 years, and for India was 25 years. And now for the vast majority of people in the world, the average life expectancy is approaching 70. 10 years ago, there were 7 countries, life expectancy less than 40. There are none now, which is real progress, but we still have 10 countries with life expectancy under 50.
What I'd like to talk about briefly is about the burden of dementia and Alzheimer's disease in the world. As you just mentioned, more and more countries have people who live beyond the ages of 50 and 60 and 70. As a neurologist, when I see someone and I describe it to my friends, a patient who comes 72, I say a young patient with, for example, a stroke has come in. So our concept of youth has changed. But with it has come the issue of confronting late life dementia. Now there's good news, bad news. The bad news is that many people who get in their 80s develop cognitive impairment. And this cognitive impairment has become synonymous with Alzheimer's disease. And this turns out to be not quite the case. We have now learned that the late life dementia is not just because of Alzheimer's disease, and it's actually a misdiagnosis to call someone in his or her 80s as Alzheimer's disease. We have learned during the past 4 or 5 years that what you do in your midlife makes a huge impact on whether or not you remain sharp when you get to your 70s and 80s. Vascular risk factors impact the brain more than anything else. So hypertension, obesity, smoking, sedentary lifestyle really impact the brain much more so than Alzheimer's disease. So that provides a window of an opportunity to educate people on ways they can do something to remain sharp when they get to their 70s and 80s.
I would like to share 3 points with you in this stage. Firstly, I was instructed by all our experts to echo loudly and very vocal what Dr. Fatui just has brought up. We need a massive attack on obesitas. It is in all our findings that this obesitas is compounding all other errors, all other failures, all other problems in our health systems and in our also in the functioning of prosperity and economy. Secondly, our findings show that we have a real problem in allocating the right personnel, the right professional capacity to a society that is really aging. And in this aging society, we will need more doctors, more nurses. But what we do in many countries is still control the entry for doctors and nurses. So what's happening? There are huge flows of migrant doctors and workers. In the US, 25% of doctors and nurses are migrants. In the UK, it's 30%, and also in other countries. And we by doing that, we are draining these brains from developing countries, which is a social imbalance that has to be restored. So here what we see is we really have to deal with this problem. The society is aging. We will need more of them in the near future.
Malaria is part of President Obama's Global Health Initiative. Our Congress is strongly behind it, wrapping up malaria and TB in the latest Hyde-Lantos bill. So there's an understanding and a commitment to infectious disease with the authorized funding. I think when it comes to malaria, it fits squarely in the strategic debate on economics, on development, on health. And this audience certainly is aware of the impact that malaria has across the world. It's called the disease of contradiction because we know what causes it, we know how to cure it, we know how to prevent it, and yet 500 million people are infected by it each year.
I think my approach to this is to talk about integrative issues that could be transformational that I see on the horizon in terms of trends, because we have lots of experts in particular areas. But what I think is kind of exciting right now is the opportunities that are opening up because of the potential of collaboration. You know, as the editor of Science, it was kind of an obvious lesson you learned week after week that the most exciting advances were usually created because of interactions by people in surprising areas and cross-disciplinary things.
I have really just a few and quite simplistic points, and one leads directly from that. And the first one is just that treatment should happen now. So there are tremendous opportunities for development, for technological advances, for innovations, and tremendous possibilities around that. But we feel very strongly that the treatment can't wait for those things to happen or for development to naturally and even with encouragement reach a point where something else is possible. So the message really is treatment now. It was very, it's terrific to hear Admiral Zimmer emphasize the need for the diagnosis and case management, that's not something that can wait until everyone has a bed net and is distributed, but that the treatment with the proper medicine, so artemisinin combined treatments, to be given and used now.
The work of the 1993 WDR, that was a really important document. What it said was, invest in health of the population and you increase output, you increase productivity, versus what it used to be, which is, you know, get the economics right and then you can afford health care. And the reason that's important is we're talking to the converted here. It's convincing ministers of finance that health budgets need to be higher, that the priority of the health minister needs to be higher, and that it cuts across all these areas. So nutrition is part of that, water is part of that, and we're about, in government's number one priority is making a healthy, educated population, not all the other things that governments do in its broadest sense.